Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Fidicus Homeopathy. Today we will discuss on what are the exact changes that will be happening in your body when you have uterine fibroids is pathology. So what exactly happens here is the middle layer in your uterine wall, that is your myometrium. Your myometrium contains muscle cells. One single muscle cell within your uterine wall will undergo rapid multiplication and it becomes a tumor. So this is one of the pathologies. This is a benign tumor. This is not cancerous. It will not grow enormously and causes cancer. If the woman secretes excess of estrogen or excess of progesterone, so if there is accumulation of progesterone and estrogen in your body in excess, this will cause the uterus to produce a tumor. So what are the reasons for this? The first reason is obesity. In obesity, what happens is there will be an enzyme called aromatase enzyme. This enzyme converts androgens into estrogen and progesterone. When you are obese, you will have more amount of this aromatase enzyme is produced in the fat cells. When you have more fat, more amount of aromatase is there, it will convert these androgens into estrogen and progesterone in higher quantities, which are responsible for producing tumors in the uterine wall. And also even the fibroid itself is the powerhouse of this aromatase enzyme. Even these fibroids have the receptors for estrogen, and also they will produce higher quantities of aromatase enzyme. This will be like a cycle. These fibroids are capable of producing more estrogen and they are capable of absorbing more estrogen, which will lead to the development of tumors within the uterine wall. How can we classify these fibroids? All the fibroids are produced in myometrial layer, that is a middle layer. From there, they will either migrate towards the inside of the cavity of the uterus or they migrate away from the cavity of the uterus. Based on the migration, how they are migrating, these are classified. First one is intramural. Intramural means these are the fibroids that are within the uterine wall. These are not touching the inner layer, that is endometrium, and these are not touching the perimetrium. They will stay in between these two layers within the uterine wall, that is myometrium. This is the first type of fibroids. Coming to the next type of fibroids, if the fibroid is touching the endometrium, so that we call as submucous fibroid. When the fibroid is touching the perimetrium, it is subserous fibroid. Based on the fibroid, whether it is touching endometrium or perimetrium, these can be classified. And coming to the hybrid fibroid, what happens is this fibroid will be touching both endometrium and perimetrium. Then we call it as hybrid fibroid. And there is one more type of fibroid where it completely detaches from the uterus and it will enter into pelvic cavity. That is wandering fibroid or orphan fibroid we call. It completely loses the contact with the uterine wall. This is also known as parasitic fibroid. And coming to the grading of the fibroids are graded from 0 grade to 8th grade based on their position within the endometrium, myometrium and perimetrium. So in relation to this, these are again classified into grade 0 to grade 8. And there are other type of fibroid, that is true broad ligament fibroid and false broad ligament fibroid. True broad ligament fibroid is a fibroid that is originated from the broad ligament, and false or pseudo broad ligament fibroid, it is not originated from the broad ligament, it is originated from the uterus and it completely detaches from the uterus and it is placed on the broad ligament. Basically it originates from uterus. Then coming to the secondary changes, once the fibroid has completed its course, so it has to go into next stage, it has to degenerate. Whatever has grown in your body, it has to sink, that we call as degeneration. Even in fibroids we see various types of degeneration. These are considered as secondary changes. First one is hyaline degeneration. Hyaline degeneration, this is one of the commonest degeneration for the uterine fibroid. Next one is red degeneration. Red degeneration, in this the fibroids become red. This happens mostly during pregnancy and also especially during second trimester. And second trimester means it will be from 3 months to 6 months, that is the second trimester. In this duration it becomes red degeneration. Coming to the next one, myxomatous degeneration. This is the rare one, no need to discuss anything about it. This is not the commonest degeneration. And coming to the cystic degeneration, this is one of the commonest degeneration. This degeneration happens in the postmenopausal women or perimenopausal women. Postmenopausal, once the woman passes the menopausal age, the degeneration that occurs in the fibroids is cystic degeneration. Coming to the calcareous degeneration, this is one of the degeneration where the fibers become calcified, it becomes like a stone, and it is also called womb stone. It is most commonly seen with the subserous fibroid. Subserous fibroid means the fibroid that is moving away from the uterine wall and it goes and sits in the pelvis as a stone. This we also call as womb stone fibroid. And one of the rare changes that happens in the fibroid is sarcomatous changes. Sarcomatous changes means it becomes cancer, and it is very rare. It is less than 0.01%.